Hello everyone and welcome to Home Health Sales Secrets. My name is Jimmy Steinacher and I'm with the Steinacher Group. We're the Healthcare Performance Strategies. And welcome to our podcast where this is number 2 of our series of different podcasts that can help you as a company, a home health agency, or a hospice or anyone else that is trying to get more Medicare referrals for your agency. If you are a owner, if you run a home health company, if you have several different locations, if you work for a larger company that has, and you're a director of operations or sales, or you're just a marketer that is out to learn more about the secrets of selling to home health, secrets to getting more Medicare referrals, this podcast is for you. This is our second one that we do, and we're going to continue this series to help you out there that are struggling with getting more Medicare admits. The one thing that we have done over the years, my last 30 years in the business, is really formulate different plans and strategies that can help you as a marketer or a company get more Medicare admits. Now, what we're going to talk about a little bit more in depth today is I want to recap what we talked about in our last session. That last session, I left you with the 5 things that a referral source or physician wants from you. I'm going to recap it. The first one is they want you to be a resource. Number 2, they want you to make them money. Number 3, they want you to make them look good. They want you to save them time, and they want you to complement their practice. So with that in mind, I want to go on to what is the thought pattern of a sales or a salesperson or a marketer in this field of what you need to think before you even get out there and make those 60 calls in a week that we talked about in our last program. So the first one I want to talk about is, what are we selling? When we're selling home health, a lot of times I've seen so many companies go out there in the field and they just say, hey doc, we got great nurses and we got great therapists, send me a patient. Doesn't work anymore. Now we have to be clinically selling. So what are we selling? We're selling outcomes. We are selling outcomes for a patient of that doctor or that facility that's going to give them a better rating themselves. Now, just like us with our home care compare scores, there's also physician compare scores, hospital compare scores, so they're ranked by the government as well as we are. So, why would a doctor want to send their patient to a home health agency that does not have great numbers? That's why it's important that you have an administrator and a DON that is working together to get these scores up, because you will need them if you're going to deal with these doctors and also the facilities. So what are we selling? We're selling outcomes. So if you do not have a program that can help that doctor get a better score or a better outcome for their patient, then why would they use you? So once again, the Steinacher Group is the company that I own. I'm the CEO and the owner, and these are some of the programs that we create for different companies. We have programs that when a marketer goes out there, you actually have something of substance to talk about to that physician. So, next thing, who are we selling to? You're selling to the physicians, you're selling to hospitals, you're selling to ALFs. You're also selling to the C-suite directors at the top of the hospital of why they need to put your agency on their list, on their integrated or provider lists. That's very, very important. Look, majority of the referrals come out of hospitals. So if you're not on their list, then you're going to have a very, very tough time of just getting those, creating a need and getting those patients from a physician, that's on their own. A lot of the doctor's offices have been sold out to the hospital systems. So there's not as many freestanding physicians as we used to have. So who are we selling to? And that's very important. Administrators of ALFs, assisted living facilities, the DON that's at the nursing a nursing home that has a short-term stay section. We're selling to a lot of different places, but if you don't have a strategy for each single one, it's all different. You're going to struggle and you're going to have a hard time. So how much do we know about our prospects' business, and what is it they need from us to turn a profit? That's what they're thinking. How do we get on the hospital's preferred provider list or the integrated list? Look, there are two lists in the hospital. There's the provider list that has everybody ranked on the list that they go into the patient's room and they say, look, your doctor ordered you home health. You're going to be going home with it. Here's a list of all the providers. Now, they're going to go from the 5-star all the way to the 0. So then they have another list that's called the integrated list. Now, to be on that integrated list, you as a marketer and your company, you need to get to the certain people that create that integrated list. The provider list is everybody on the Medicare score chart, okay? The integrated list are those top 4 or 5 agencies that they have screened for a different formulary. And if your agency has not been invited to the table of the hospital to negotiate on these things, you're going to be blocked out, okay? So that integrated list, there's formularies that they create these lists with, and there might only be 4 or 5 agencies. There's things that that you probably never even think of as a marketer, but your administrators and your owners, they should know about these things. So you're sitting down with the powers that be at the hospital, and you're going to go over things like your length of stay, your outcome scores. Do you front load? What are you doing to keep the patient out of the hospital for 30 days? They want to know your cost per patient. They want to know a whole slew of information about your agency. And trust me, don't lie to them because they know they have the information in front of them. They're just questioning you. So we could talk more about this on another episode. So how do we get on the hospital's preferred provider list and the integrated list? What are our outcome scores? If you're going out there today, what is your outcome scores on medication management? What is your outcome scores on things like fall prevention? What is your outcome scores on keeping the patient out of the hospital for 30 days? Once again, if your agency does not have these type of programs, us at the Steinecker Group, we have taken 30 years of knowledge and designed these programs for you so you don't have to go back and create them all. Once again, you can contact me, Jimmy, at the SteineckerGroup.com, and I will be glad to reach out to you and tell you a little bit more about our programs that we have that we design for your agency. Once again, my email number is jimmy@steineckergroup.com, or you can reach out to me at 337-281-2189. Now let's continue. How do I market to them whether they're good or bad? Well, the bottom line is, like I said, if you're marketing to a physician and your numbers are not very good, once again, these numbers can be skewed. You know, it all depends on how that nurse is going to rank the patient when they admit them. If they're coming in at a 3 on falls or mobility, there's no room for there's room for them to improve. But if they come in and they rank them at a 0, what's going to happen is this patient has nowhere to grow, so the outcome is not going to be very good. So the people have gotten very smart. Agencies have gotten very smart on how to finagle these numbers. So how do I get to market to them whether they're good or bad? You have to have programs. You need programs. If you don't go out there with a program and sell to a physician, your chances of getting a patient are very slim to none. How am I going to sell to hospitals if I'm not on the list and my agency needs that extra $500 add-on? There's a $500 add-on for facilities for the patient versus someone that comes from the out-of-line areas like a doctor's office. So how are you going to market to that hospital if you can't get on the list? See, that's something that you need to come together with your company and say, look, we got to figure out how to be a player in this market or we're going to be boxed out. And I've seen agencies be boxed out of their communities because of the fact that they can't get on that list because 1, they don't have the numbers, 2, their cost per patient's too high, 3, their length of stay is too long. So all these factor into how I will get on that list. So sometimes it takes a little work and it's not going to happen overnight. Now you can still call on some of these hospitals. You might have a case manager that you know very well that slides you something, but let me tell you something. Those case managers are looked over by their head of case management. And then there's somebody over the case management department itself. So that's a secret about selling out there into the market. So these are all things you need to find out. How do I sell to internal med doctors versus a neuro, ortho, surgeons, cardiologists, oncologists, you name it? Listen, not all sales calls are the same. Whatever you're going to talk to a neurologist about is not the same what you're going to talk to a cardiologist about. Once again, if you do not have the programs to go in there and talk to these different types of doctors and different referral sources, your chances are slim to none. Think about this. If you've got 60 calls to make a week, now remember, I also take into discount that some of these markets are small. You might only have 10 or 12 doctors there in your town. But some of these larger markets that we talked about in the last episode, they have thousands of doctors. So that's what I'm kind of talking about right now. So if you're going to see a neurologist today, and you're going to see him next week, and the week after, and every week because he's on your call report, what are you going to talk to him about every time you go in there? You can't just keep going in there saying, hey, doc, stopping by, see if you're going to give me a patient. You need to help him create a need. What is that first thing that I talked about that they want from you? You need to be a resource. If you're not a resource to that doctor, guess what? You're an interruption to their day. They're trying to make money. They have a caseload. They sometimes book 2-3 different patients on the same time. That's why the offices back up. So the thing about it is, when you go into his office, you cannot be an interruption. But if you go see that same neurologist week in, week out, the bottom line is if you don't have something to help that physician create a need and help him identify or her identify a specific patient that you want. So let's look at neurology. You know, you need to go in there and help them identify points or identifiers for a CVA patient, someone that's had a stroke, Parkinson's patient, someone that's had multiple sclerosis, someone that is maybe on Coumadin because they're taking Coumadin, a blood thinner because of the stroke. So you need to have a plan every single week that you go see that same doctor. Every single week. Because what's going to happen is you're going to walk in there, your first visit, say, hey, this is who I am, and then what do you do after? That is the fall of home health today and any other outside sales. We don't help them create a need to give us, to identify that patient and give them to us. So, how am I going to sell to hospitals if I can't get on the list? How am I going to differentiate myself between the different doctors and what am I selling? What am I going to do if I never get on the hospital list? You know, these are things you have to think about. What am I going to do if the person, my contact that I have in the office leaves? Look, we've all had contacts in offices that was our good friend that we just take a liking to and they like us and they feed us those referrals because the doctor gives them that carte blanche and all of a sudden that person leaves and you don't know where they went. Now you're starting all over again. That's why I always tell marketers, you need to know who the physician is. You need to build a rapport and a relationship with that doctor because they need to know who you are. Because if their frontline employee leaves today, you just lost your pipeline. Your pipeline is the one that feeds you. So, speaking of pipelines, that's what we want to create off of every single contact that we make. We want a pipeline of business for every referral source that we come in contact with. So, continue on of some of the other things. How can we help our referral sources with their scores? So, think about this. These doctors are also rated just like us. So their outcomes are just as important to them as they are to us. So how do we help them? I'll tell you how you help them. By getting a better outcome for his patients that he refers to you. Look, I've had several doctors through the years send patients because of the fact that we went in there with programs to help them identify. The nurses followed the programs. The outcomes were excellent. And guess what? The repeat business came. So it's a formulary. We cannot just say, hey, let the nurses out there and let them do what they want. There has to be a program for them. There has to be a goal. The patient has to reach goals. So the bottom line is, the first thing we want them to do is always learn about the disease itself. Your patient, they have to know. And a lot of times they get these diseases and they don't know how to take care of themselves. That's why we're there. Going on again, what about the physician MIPS and APM scores? See, a lot of people don't even know about these things. A physician that works for a hospital or that is in an ACO, an accountable care organization, they are ranked on what is called a MIP. It is called a merit score or an APM score. Now, those things right there, the physician will go into a portal and they will put in the portal the specific disease on that patient. Say it's coronary artery disease. And what will happen is in that portal, Medicare will state to them exactly what they need to do in sections to get 100% of their score to get 100% of their pay. Now listen, they've got to reach, they need to reach into that 80th percentile for them to get 100% of that pay. So they need to get in there. If they're not, they don't get the reimbursement that they thought they were going to get. A lot of doctors, they don't like the system, but it does help them and it guides them on what they need to do for that patient for Medicare to give them a good outcome score. The APM is just an advanced payment merit system of this, and that's all. It tends to rely on the hospital or the ACO, how far they are and how they want to do it. But the bottom line, what we deal with is helping that physician. Look, say they pull up coronary artery disease. About 30 or 40% of it is going to be about meds management. So medication management is something you need to sell to them about how to reach that goal. On top of a lot of other things that are on that portal that's telling them what they need to do for that patient. And is that patient tested to see if they really know it? So the government wants to know. So that's another topic in itself is MIPS. Do you have a 30-day rehospitalization program that can help the hospital and help the doctor? Look, the number one thing that the case manager wants is for you not to bring that patient back in the 30 days. They don't want them in their ER. One of the top reasons why they come back in the ER? Anxiety to medication. They have an adverse reaction to medication in the first 72 hours. And that patient's coming back into their ER. A lot of it has to do with anxiety. But we're going to talk more about medication management in another episode. Here's something else. Have I spoken to the head of case manager to inquire about the quality assurance involvement in the creation of the hospital list? Or who is the VP of post-acute services? If you're not on the list of the hospital, you need to contact case management and you need to find out who is in charge of quality assurance and who is the VP of post-acute services. Because those are the people that you need to sit down with to try to get yourself on that list, especially the integrated list. Because that's who gets the lion's share of the Medicare referrals, the traditional Medicare referrals. I'm not talking Advantage, I'm talking about true Medicare, the traditional Medicare, are going to those top 4 or 5 agencies on that integrated list. Something else. You have to ask yourself, is there a joint venture between a hospital and another home health agency? What do I need to do to get their business? That's something else you need to think of. Look, if there's a joint venture with a home health agency and a hospital, well, who do you think they're going to choose to send their top traditional Medicare to? Because there's a financial arrangement in this deal. So you're saying, okay, how am I going to get in that? Well, that's going to take your leaders above you to go out there and help you get on that list again. And also, look, they can't just send all their business to one agency. Medicare will not allow that. And look, there's foul play when it comes to that. So the hospital will spread it about. They're not going to give all their business just to that one agency that they have a joint venture with. Here's another thing. What do I do when the home health regulations change every year? I spoke about that in our first issue. There's nothing you could do. Just get more business. More Medicare business will offset it. What do I focus on during the summer months versus the other months of the year? Look, there are cycles in this business. But the one thing that doesn't happen is diseases don't take holidays. If you have diabetes, you have it 12 months out of the year. If you have heart disease, you have it 12 months out of the year. Now, the bottom line is, sure, it does slow down a little bit around the summertime, but there's other diseases that spike up. So you have to know that. When you work with us at Steinacher Group, we help you with all these different ups and downs and the different seasons that are out there with our different programs that can help you go out and still create a need. There's no reason for you to drop your census a lot during the summertime just because it's hot. No, diseases are still out there. Now, of course, some of the respiratory diseases will go down a little bit, but COPD doesn't. It still doesn't. Heart disease ramps up. You got neural diseases ramp up during the heat of the summer. So there's all different types of things that go on in the year that you can actually target to get more business. So, and finally, so many questions that you need to ask yourself before you go out there and you go market. It's more than just, here's my business card, here's a trifold brochure, my name's Jimmy, I want to do some business with you. It's beyond that. You have to be prepared. You have to know what your market is about. Look, my name is Jimmy Steinacher. I'm with the Steinacher Group. We're Healthcare Performance Strategies. If you need help out there with gaining more Medicare referrals for your home health agency or your hospice or any other type of business out there that's healthcare, give me a call. My email address is jimmy@steinachergroup.com. Or you can call me at 337-281-2189. In our next episode, we'll talk more about some of the challenges that we face in home health and what may be blocking you from getting those referrals. And then we'll come up with some solutions. Until then, create a need to sell.